For Ausland being unavailable at the moment, we'll make sure that Ausland interpreting will be put up on the Department of Health's website as soon as possible after this morning's media conference. Can I thank you all for coming? I've been joined by Jerome Weimar, the COVID commander, and Dr. Mukesh Harkawal, former president of the AMA, leading physician, GP, and a fantastic advocate for Melbourne's West. Dr. Harkawal is a GP in Altona North and widely respected for his medical expertise and his community leadership throughout so many issues, but particularly during the COVID-19 pandemic. He's also worked very closely with the Department of Health about ensuring that testing, community engagement and vaccinations are at the forefront of Melbourne's West. Today's numbers are very much a reminder that this virus has not gone away and that particularly when it comes to variants of concern, the whole rules of how the COVID-19 pandemic is playing out are changing and we need to change along the way. We've seen record numbers in New South Wales today, and we're seeing cases in Queensland, and sadly we've seen a number of deaths in New South Wales, and our sympathies to all of those families concerned. Here in Victoria, the numbers that we announced this morning in our release of information, there are 6 newly acquired cases and no cases from hotel quarantine. There are 7 people in hospital as a result of COVID. 2 of those are in ICU and both are on ventilators, and we send our warmest and deepest support to those people and know that they're in very good hands in Victoria's public health system. There were 27,279 COVID tests processed yesterday, and Jerome will outline some of the rapid testing responses that have been mobilised in Melbourne's West and other places to respond to the most recent cases. There were 17,229 vaccinations delivered through Victoria's state-run clinics, and I'm confident there would have been a substantial number more through our GP and primary healthcare networks. In the state-run clinics, we're at 1.71 million doses administered through the state system and more than 3 million administered statewide. 3 of the 6 cases from yesterday relate to close contacts of the already understood Moonee Valley case from a few days ago, indeed a week or so ago, and those 3 are primary close contacts of that particular cluster and have been isolating throughout the time of their infectious period. So that's 3 of the 6. In regards to the other 3, 1 was a case that was identified late yesterday. He lives in the city of Maribyrnong, and the source of that infection is unknown, and we're conducting, came in quite late last night, we're conducting interviews both last night and again today, and we'll have more to learn and to say about that particular case soon. So that's 4. The case reported late yesterday that resides in Hobsons Bay local government area is the case that works at the school in Truganina, and a household contact of that case has also tested positive. So that brings us to the 6 cases that we have announced today. And of those 6, 3 of the cases are unlinked to the current outbreak. Genomic sequencing is underway and should be available either late tonight or early tomorrow. The public health team is investigating the circumstances surrounding these positive cases, and Jerome will have more to say about that in the near term. The initial case from the Hobsons Bay local area experienced the typical COVID-19 symptoms, a fever, a runny nose, cough, headache, loss of sense of smell and taste. And she did the right thing. She came forward and got tested. She got tested at an Altona North testing site and returned a positive result yesterday. Household and workplace testing is already well underway, and as I've indicated, one member of her household has already returned a positive case. As with any new case, we are investigating where she was during both her acquisition period and those sites that she visited whilst she was infectious. And so far, here is what we know in that regard. Numerous exposure sites have been published online so far, and as interviews continue and as work in verification continues, we would forecast that there will be more exposure sites listed, and could I urge everyone to keep a very close eye on the Department of Health's exposure website to stay up to date with this information. Just run through a few of the key ones. There's the Coles Yarraville on Williamstown Road from last Thursday, the 29th, between 4:30pm and 5:30pm. That went up last night. That's a Tier 2 site. That is, test and isolate until you get your negative result. Other sites that have been listed this morning, in Caroline Springs, we have Spectacle Hub, the National Australia Bank branch ATM, Woolworths in Commercial Road, and Dababa House. In Altona North, we have the Elm Road Medical Clinic, the Wolf Cafe and Eatery, the Caltex Service Station, and Pharmacy for Less. In Newport, we have Star Pizza and Pasta and 181 Coffee. One of those cases that we've announced, of the three cases that we're investigating, one of the cases plays football at the Newport Football Club, and we've been in contact with the club, and can I thank the club for the proactive way in which it shared that risk with its members and the wider community that it's a part. In Spotwood, we have Elite Sports Performance Gym, where one of our cases worked whilst infectious. The workplace that one of our cases has worked at is the Al-Taqwa School in Truganina, and last night the school was listed as a Tier 1 exposure site. All students, staff and visitors to the school on the 28th, the 29th and the 30th of July have been contacted directly, and they must now get tested and isolate until further notice. And so too must their families. So that is a very large number of people who are primary and secondary close contacts in the multiple thousands. We've also set up a testing site today at Al-Taqwa College and in other sites in the West, in addition to the number of already established testing sites in the West and the North. The Department of Health is working very closely in partnership with the Western local public health unit in supporting that local community, and is working very closely with the school principal and the school leadership. And I want to congratulate the school. As we know, this school has been through this process in the past and have learnt and engaged in so many ways, and have been exemplary in the support and the systems that Jerome will go into in more detail. So we are urgently testing the people who are closest to our particularly three unlinked cases, and we are also advising, when it comes to those multiple thousands of people in the Al-Taqwa College in particular, testing those people and those who are close to them, so as to make sure that we understand the patterns of potential transmission of the virus in and around that school community. So can I stress that all of those community members need to get tested and to isolate until we know more and until they get further information from our department and from the local public health unit. We've always said that we will continue to assess the outbreaks and the COVID pandemic on a day-by-day basis, and we know that things turn very quickly. We started off yesterday with no cases, and now 24 hours later we have at least 3 unlinked cases, and that just goes to show that this pandemic is not over and that the situation we all continue to face is really significant and is really one that is of great concern to our public health team and to all Victorians. And we need to make sure that these 3, at the moment, unlinked community cases are better understood, and where their chains of infection may have either been acquired or downstream where their infectious period of activity may have been in the community. As always, throughout this pandemic, we will be guided by the public health advice and provide further updates to Victorians if and when that advice changes. I'll now ask Jerome to provide a bit more of an update and then ask Mukesh to say a few words, and then I'm happy to take questions. Jerome.
Thank you, Minister, and good afternoon. So with regard to the existing outbreak that we've been dealing with over the last few weeks, 3 new positive cases today, all existing household contacts, primary close contacts, all in isolation, and they continue to isolate safely. That takes us to a total of 77 active cases of coronavirus associated with that pre-existing outbreak. Yesterday we cleared around 500 primary close contacts from that outbreak. That now means there's less than 2,500 people remaining in isolation, coming to the end of their 14-day isolation period in support of that previous outbreak, and ensuring that we completely finish that one through. And we continue the work, of course, around La Crosse apartments. We started day 13 testing there yesterday. We'll continue that today and tomorrow. So again, expecting those PCC numbers to come down over the next few days. As the Minister has said, of course, 24 hours is a long time in any pandemic, and we have a significant new board of work to do over the few hours and days or weeks ahead of us. Of the 3 new cases today, they represent currently 2 unlinked areas of investigation, and of course most of our work now in our testing and tracing teams is to try and establish both where those cases derive from, and of course are there any downstream further cases that we need to identify and isolate. The case in Maribyrnong, a man in his 20s, he has now tested positive. That was late last night. He works in a warehouse in Derrimut and lives with a flatmate. The flatmate has been tested. We're awaiting his testing results hopefully during the afternoon today, and we're undertaking testing of his workplace colleagues. That is, of course, at the moment we have no other information about possible source of acquisition, but that of course is an ongoing investigation as we interview him and his family and household contacts. The other 2 cases are a couple in their 20s who live in the city of Hobsons Bay. The male in that partnership is somebody who works in Caroline Springs, and he's also the individual who plays for the Newport Footy Club. So we have now tested both his workplace colleagues in Caroline Springs. We're awaiting test results from that during the course of today. We have also tested some of his wider household contacts, so family relatives who do not live in the same household but nearby. I can confirm that 2 of those household relatives have also turned positive. So those are not in today's numbers, but they are numbers that will be in tomorrow's report. So those are 2 positive cases related to the gentleman from Hobsons Bay who live together but in a separate household. We have more test results to come back in from other immediate household and social contact members. As I said, this individual also plays for Newport Footy Club. We are, of course, working closely both with Newport Footy Club but also with West Footscray Football Club. There was a match on Saturday at the Shorten Reserve. We are working particularly with the 2 teams that played on that afternoon to get them tested as quickly as possible, and of course to undertake the normal isolation procedures. The other positive case in the Hobsons Bay household is a teacher or a staff member at Al-Taqwa College. Now, we have had fantastic support over the last 20 hours or so from Al-Taqwa College and working with their school leadership to reach out to the whole school community. And we've been through a number of school outbreaks now in very recent memory. We had the 4 big school outbreaks with Trinity Grammar, Bacchus Marsh Grammar, St Patrick's and Barwon Primary only a few weeks ago. And we will adopt a very similar playbook to how we support the wider school community around Al-Taqwa. As such, yesterday at around 4 p.m, all members of the school community were informed through a combination of the school and our public health team that they are required to isolate for 14 days. That is around 2,494 people, staff and students at that particular site. We have around 300 students in particular who are most closely associated with this teacher. We are of course prioritising them and their testing results at this time, but the entire school community of 2,494 people need to complete their 14-day isolation, as well as any household or family members that they live with. And this is really important. So not only is it the children who attend that school, but it is also whoever they live with, their parents, their siblings, grandparents, other relatives, anybody else who normally lives in the same household must isolate for 14 days. We started testing late last night with additional testing provision at the showground site for 8 p.m. And of course today we have about 13 sites in around the western suburbs who have expanded their operating hours. Showgrounds in particular has doubled its capacity, and we've provided some dedicated capacity for members of the school community. In addition, there's a dedicated pop-up testing site at Al-Taqwa College itself, again for members of the school community, and we're working through the school community to ensure that all their members understand the arrangements and get supported to get tested. We will of course activate our normal family support arrangements for all members of the school community. So in terms of food and welfare support, that will be provided through a combination of Victorian Government services, local councils and other agencies, and we'll be working with people during the course of the next few days to make sure those arrangements land appropriately. The most important thing is that people are supported to isolate safely and effectively, and that's what we'll be doing over the next few days. At this point in time, we'll of course continue our test and support. We expect to have more results late today and into tomorrow, and that of course will inform the next stages of our public health response. With that, I'll hand over to Mukesh for an update on his wider work. Thank you.
Good afternoon, and thank you very much, Minister, for the invitation, Jerome. As is customary, I'd like to acknowledge the traditional owners of the land in which we meet, pay my respect to elders past, present and emerging, the Wurundjeri people of the Kulin Nation. I work in Altona North. We've been running a respiratory clinic there since March last year. We've done more than 21,000 tests there, and by the end of this weekend, 12,000 vaccinations. It's something we're grateful to be able to do for our community, and something that the federal government actually helped us do with our respiratory clinic system. The case that has been mentioned, that was discovered, we did the test 2 days ago. We notified the appropriate people yesterday, and we made sure that the appropriate things were set in motion. It's a very different situation this year to last year, and when we heard the school Al-Taqwa was again involved in this, the initial thought was, here we go again. In fact, it's a much better place that we're in now than we were last year. The health department is working with the local council, is working with the local healthcare professionals and general practitioners and other providers to make sure that we know what's going on, that we know the tests are needed, that we know people should be isolating, and that we've actually in a much better position because there are no vaccinations available. At the beginning of this year, I was voted the Citizen of the Year for Hobsons Bay. And when I gave my acceptance speech, I actually dedicated that to the people of Hobsons Bay because we had done it really tough. When we started testing in March, there was no positive results until July the 1st. And then we had 118 tests, and many of them were actually in a week. And so the population did it really tough. The way they were treated, they felt they were very badly treated, and that's why many people didn't get tested. All of that has changed. The local council, working with the state government, is actually providing wraparound services. So somebody does need to get tested, does need to isolate, they're not doing it on their own. They're doing it with the support of the community, the support of the council, and I'm grateful to say the support of the state government. This is an illness that anybody can get. When the minister read out that list of places, this is my manor, this is where I work, and this is where I live. And it's real. And we know that this is not a disease that doesn't kill. And it's not just a disease of older people. There's a tragic case in Sydney where a 29-year-old man died on his 13th day of isolation. This is real. This is with us. We can do this, but we've got to do the right thing. In my area, it means, as the Minister has said, as Jerome has said, if you get any exposure, go and get tested. When you got tested, go and isolate. The department will advise you whether you need to isolate for 14 days or whether you can come out of isolation with a negative test. It will vary depending on your level of exposure. When you come to a setting like ours, you have to make an appointment, but that's not a hindrance. It's a help because you don't have to sit around and queue. We are running our clinic today from when I get back there at 1 o'clock until 7:30 tonight, non-stop with multiple tiers. And we're doing the same tomorrow to give that capacity. This morning we immunised over 160 people. On Saturday we'll do another 400. By the end of this week we'll have done 12,000 vaccinations. That is our way out of jail. We've got to get vaccinated. We've got to make sure people get the right information to make the right decision about vaccinating themselves. And we need to make sure that we make the facilities available for people to get vaccinated. This is not a Hobsons Bay issue. This is not a Western Suburbs issue. This is not a Victorian issue. This is an Australian issue. And in fact, it's a global issue. So we've got to get out there. We've got to do the right thing. Understand the requirements which are done for good reason by reasonable people asking us to do the right thing. Australians are good at doing the right thing. They're good at getting each other's backs. And this is just what we've got to get out and do. Thank you.
Thanks, Mukesh. Happy to take questions.
Minister, is a 3-day lockdown on the table?
We've got nothing to say at this time. When we get public health advice on how to respond, we will be sure to share that as quickly as we possibly can with the Victorian people.
But is it being considered?
Our public health teams consider all the evidence and all the material as it comes to hand. As you've heard from particularly Jerome's contribution, a lot of that information is being collated at the moment. We need to look upstream for acquisition sources for these 3 cases and the further case that Jerome pointed to from family acquisition that's emerged today. And we need to look downstream as to exposure sites. So putting all that together, our public health team will make a risk assessment and will bring forward their decision as and when it's made.
But are there discussions being had right now about the 6th lockdown?
There are always discussions every day about how to best respond to changing public health issues. We've been upfront and transparent on what those discussions are, where the risks are, and the processes that the public health teams are going through. When the public health teams collate and bring all that information to bear, should that see a change of circumstances, we will certainly share that as the most timely possible manner.
For these new cases that we're dealing with, the Delta strain, do we know that?
So genomic sequencing is underway. We're working on the basis that it is, but when that genomic sequencing is in, we'll have more to say. We're working on the basis that it is, and that's basically the only variant that's transmitting in the Victorian community at the moment. But when the genomic sequencing comes in, we'll certainly release that information.
And we really have no leads at all on where the teacher got it? No idea?
Not at the moment. Conversations continue, and we thank the family for the open and frank way in which they've shared all that information. And when those investigations conclude, we'll have more to say.
You said those extra cases included in tomorrow's figures are family members of the man that you've mentioned. Were they visiting separate households, or was that a catch-up that happened out of the house?
I don't have that information. All I know is that they're familiar. They're the direct family members of the gentleman concerned.
When will we have that information?
When the interviews are complete, I'm sure, and those interviews are ongoing as we speak.
Did these cases come forward immediately when they were symptomatic?
As I understand it, indeed, as Mukesh indicated, it was his respiratory clinic where the cases were tested. And from my understanding from those cases, as soon as the symptoms were being displayed, people came forward. Symptoms display is different from infectivity period, and that is, of course, why we're very concerned as to what the acquisition sources for these cases might be.
There are some issues in the delay as to how information about new exposure sites and new cases are coming out. The school was told about the case there at 2:30. They told the students and staff at 4 o'clock. It wasn't listed on the department's website until 10:30 at night. Is there an issue there in how information is getting out when every hour counts?
No, I don't believe so. We've been working very, very closely with the school and the school leadership, and the processes of the engagement with the school community have been really solid. This is a school that, as Mukesh has indicated, has been through this before, and their processes and learnings and the communication of both their own school community, other schools that they had engaged with, and their partnership with the Department of Health and the Western Local Public Health Unit have all gone exactly as we would want them. The school initiated, with our strong support, in direct engagement with its school community, and when our public health team went through that process of sharing that information publicly and the normal verification processes, we listed that as a Tier 1 site. Similarly with the Newport Footy Club, the gentleman, the second case that we're working with from today's numbers is a player there. He did all the right things in letting the people that he had interacted with know, and that club stepped up and did the right thing. And we've gone through a similar process of verification, and as we've indicated, various workplaces, various retail outlets, all of which have been verified from those conversations, have gone up on the website. And as conversations continue, we forecast there will be further exposure sites listed.
Is there anything the department can do to get that information out quicker though? As you can understand, people are really keen for that information.
Yeah, of course, and that information was provided publicly very quickly to communities, and through those communities through you, the media, to the Victorian people, and that information was out and about and verified very quickly indeed. In terms of how it's then verified on the Department of Health's website, as you would expect, there needs to be a process of verification, and that was done in a very timely way. As you've seen by the number of sites that have gone up today, continues to be done in a timely way.
There were some reports though that both of those football clubs that were playing at that Saturday match weren't alerted by Victoria Health until this morning, even though that man was positive yesterday afternoon. Is that right? What was the delay?
Well, as I indicated, as a positive case, those positive cases, quite rightly, in terms of the discussions that they have with our public health team, share their processes of engagement through the community when they're infectious, with their family, with their work colleagues, and in this case with their sporting clubs. And I commend the Newport Footy Club for doing the right thing and coming out to share through its social media and through its contact with its players and its communities the risk that they are facing, and I think they've done an outstanding job. This is all part of what is now the normal processes of using all forms of media, all forms of engagement to get information out to the community as soon as possible.
Minister, why won't you implement rapid antigen testing on the hundreds of thousands of people at the school like Al-Taqwa, people associated with the footy club, which would promote people who wouldn't normally go for a PCR test, perhaps to be tested and perhaps avoid lockdown?
Rapid antigen testing is a important part of a much wider field of how testing is done. Rapid antigen testing is not as accurate as PCR testing. Rapid antigen testing is used widely in other parts of the world that have rampant COVID, and in those circumstances forms a very different part of the armoury for how testing is done. Rapid antigen testing throws up, depending on which platform's being used, in the Victorian and Australian circumstances, relatively speaking, unacceptably high number of false returns. And the Victorian government, and indeed the Australian government through both the TGA and the AHPPC processes, think that the most accurate form of testing, the diamond standard form of testing, is PCR tests. I would have thought football clubs, communities want to know that the test result they're getting is accurate.
But are PCR tests being phased out in other countries such as the United States? They're told effectively by Christmas time to find something else?
Well, I'm sure that the United States and that other areas that are well down the path of mass vaccination processes that have had amongst the highest number of positive cases and deaths in the world make those decisions based on the circumstances at hand in their communities. The Australian public health response is a very different set of circumstances in regards to both our number of positive cases. Fortunately, however tragically, as we continue to see, sadly even today with 5 deaths in New South Wales, the circumstances in Australia are different. And with those different circumstances come different managements of risk. We're not saying that rapid antigen testing, which is essentially serial testing, it's not a one-off thing. Rapid antigen testing is used in circumstances where you test the same population rapidly on numerous occasions. We want to make sure if we go to a school community, a football club, any organisation, that those tests are as accurate as possible, and the PCR test is the most accurate. That is not to say that at one time, as the national strategy that was endorsed in principle by National Cabinet plays out and the phases move, that rapid antigen testing may well prove a part of our armoury. But at the moment, the risks are such that I think people expect their tests to be as accurate as possible.
How many primary and secondary close contacts?
I beg your pardon?
Sorry, how many primary and secondary close contacts are linked to the 5 cases considered unknown?
So as Jerome indicated, we're already past 2,000 to 3,000 primary close contacts, and we would imagine, given our understanding of the school community, as well as the other exposure sites that are coming online, that we will very quickly pass 5,000 to 10,000 close contacts and secondary contacts within hours, if not days. Big pardon? Sure.
I've had one for the whole. Sorry, Jordan,
Yeah,
just
mate.
on those testing delay questions before. If
Yeah.
we knew that the players' wife was infected since last Wednesday, why did we wait until he had tested positive?
Well, we knew the two results from yesterday came through late yesterday afternoon, not last Wednesday. So not sure where you go, Mitch.
Infectious since last Wednesday.
Yeah. And
So why did we wait until he had tested positive as well this morning to let
let
people know?
who know?
The public.
Well, look, hang on. Let's back up a bit. So last night we had 2 positive cases that came through. We were very clear publicly with the school community in particular late yesterday afternoon that we had a positive case, and our absolute focus was dealing with the most significant number of primary close contacts and people who were potentially at risk. We spent most of last night into the early hours of this morning dealing with the other positive case in his interviewing process around where they'd been and what contacts they'd had, and making a public health risk assessment around what were the priority sites to go after and who do we need to communicate with. Late last night we got hold of the football clubs were contacted late last night, early this morning, and that conversation carries on. And again, I'm happy to take questions that says the speed at which we work here in Victoria is that we're now managing these things by half-hour segments, and that's absolutely fair play. But we were public on this from late yesterday afternoon, dealing with a new and a separate set of unlinked cases. Of course, the Derrimut case landed in the very early hours of this morning. We're still working through that. And again, more news will continue to evolve. These are rapidly developing scenarios, as they always are. There's a lot of information to process in the first 24 hours, a lot of people to come forward, and for us to really start to build a picture of how this outbreak is going to run.
Jerome, how
Some.
many schools are currently closed as a precautionary measure due to the Al-Taqwa
Yeah.
case, and also due to any household contacts or a sporting carnival
Right.
that I understand
Yeah.
Al-Taqwa were involved in?
So from a public, it's a good question, Simon. So from a public health point of view, only Al-Taqwa College is closed because that entire school community has been deemed as primary close contacts of this case. We understand at least 2 other schools have taken a decision to also close. We understand because of potential overlaps in the student body. And that, of course, is a judgment for those schools to make. We're also working with a number of schools around a potential sporting event that was held in the last 2 days that may have involved students from Al-Taqwa College. This is all work we continue to do over the coming hours, and of course as we interview the student body, as we get a better understanding of their movements, as we start to see testing progress through that primary close contact group, we'll get a better understanding of what other schools might be impacted further down the road.
Will students at that sporting carnival?
Sorry, go Paul. Yeah. So at this point in time, my understanding is that she came forward for testing on Tuesday. So the day before yesterday, we got the results yesterday afternoon. She certainly worked Wednesday, Thursday, Friday of last week. Also, the partner she lives with also had a number of days out in the community before his testing period. We are taking a very precautionary approach to the presumed infectious period for these cases, given the settings that they're in and given the importance of how we've seen the Delta strain emerge. So my understanding is they both came forward swiftly upon the symptom onset, but certainly we are going back, 5-6 days of them being out in the community. Yeah, so Rachel, I don't yet know quite what her working patterns were. We know that she's declared that she worked Wednesday, Thursday, Friday of last week. My understanding is she didn't work for any time this week. Whether she was scheduled to work or not, I don't know at this point. Mm-hmm. Yep.
And these cases, there was an exposure site for the Moonee Valley
Yep.
versus the Yarraville.
Yep.
Do you believe there is
So look, we're keeping a completely open mind to all lines of investigation. So based on the initial interviews that we've had with the 3 positive cases in the numbers for today, none of them have identified any exposure sites or any obvious connections to the existing clusters that we've been working on. We've obviously looked at connections in the Yarraville and Newport areas. At this point in time, there doesn't look to be an immediate overlap, but of course that remains a line of inquiry. So as we always do with these cases, when we find a case where we can't make that immediate connection, we go as wide as possible. We'll look for any possible connection, and at this point, nothing's ruled out. Yep. 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 That's right. Yeah, so look, we've seen wastewater detects over the last few days, as you say, in Caroline Springs, also in Altona North. That does correlate with some of the cases that we've seen in the last 24 hours. So we know that one of the positive cases in today's numbers works in Caroline Springs, so there's a potential connection there. We also know that one of the 2 cases that I've announced this morning, so not yet in the numbers, but the 2 that are identified in the last hour or 2, also have, we believe, are in the Altona North watershed. So there are possible connections in that. Obviously, a lot more work to do over the coming hours and days. Yeah. Yeah. Yeah, we haven't got an update on that one yet, Rachel. So look, we have strong reasons to believe that there's a connection between the Moonee Valley Testing Centre, the traffic controller, and the wider outbreak. We haven't quite closed that file yet. We got a bit distracted yesterday afternoon with a bit of new work, so we will close that file in the next day or 2.
Is that likely to be a connection between positive cases that came through the testing centre or something external to the testing
Yeah. When I close the book, I'll let you know.
We've had a week of people infection,
Yep.
sets of cases in a row.
Yep.
Basically a week and a half, not in lockdown.
Mm.
It's pretty likely the exposure sites are going to blow up in the coming days, right? Probably going to see new upcoming cases. How concerned are you about where this is going to go, and does it seem likely the contact tracing on its own is probably not going to be enough?
Oh look, I mean, obviously, 24 hours ago we were standing here on a donut day. That's a much more comfortable place to be. Here today we're dealing with 3 unlinked cases, 2 possible clusters, and as you say, an emerging number of exposure sites, large number of primary and secondary close contacts, a lot of work to do. Having said that, we've been here before. In fact, we were here only 3 or 4 weeks ago. So we have a process, a plan, and a machine that will run through this, and we do it with the support of the community. And as Mukesh has said, this is a very different prospect to what we were dealing with a year ago. The Delta variant is very different, but then again, so is the Victorian response. So we've got a lot of work to do in the next few hours. It is a rapidly developing situation, and as the Minister has said, we've got people working back at base very hard to assess all the information that's coming in. We've got a number of important test results to land in the next few hours, and that will shape the next stages of our response, as it always does.
We've got these cases. The Minister said we could get to 10,000 close contacts
Yeah.
in these cases in just a matter of hours.
Yeah.
What's the threshold to send us into another lockdown?
Oh, look, I mean, as we've always said, we always judge the situations on the facts. It's a decision ultimately for the public health team and for the chief health officer, and that's their role over the coming hours and days to assess this situation as they assess every situation. We have a good and a fast response around this, but we'll have to see over the coming hours and days as to how those numbers start to move, whether other cases start to emerge, and also what those acquisition sources are. A number of unknowns at this point in time, and those are all questions we need to get to answers to quickly.
Is there a nervousness about heading into the weekend? Are we likely to hear something at the end of the weekend?
We, as we always do, we'll judge it based on the information that emerges over the coming hours and days.
We've always worked on the basis that cases are infectious 2 days before they're symptomatic. Is that a change now that we're looking at doing it 5 days?
No, look, I think again, we do individual case interviews with the cases that turn positive. We do that with every single case we have. We make a decision based on what they describe, what symptoms they describe, what their own clinical history is, and the context in which we're operating. On the basis of those interviews, and I wasn't in them, a judgment's been made to bring those exposure periods back to the 28th and the 29th respectively, and we'll work with that information as we go forward.
The Premier just spoke about you've got to work on Monday.
Yeah.
Or Tuesday.
Correct.
You got tested on Tuesday.
Yeah.
You was at work all last week.
Yeah.
The infectious period's been taken back to Wednesday.
That's right.
But all of those things point to her having told interviewers that she was probably symptomatic on the Sunday or Saturday if you're going back to the Wednesday. Is that the case?
Look, at this point, Paul, I don't have that information in front of me. What I can be very clear about is, look, we're talking to those individuals. We're trying to understand their working patterns and their movements. I don't know why if she may not have worked on Monday and Tuesday because she wasn't rostered to work, she may have chosen not to work because she wasn't feeling well. That's the information we're doing within those interviews.
The Premier just spoke about people not waiting to get a test and stressed that in particular. So are you suggesting that she came forward swiftly enough that you're comfortable that she wasn't symptomatic on the Friday, or did she tell you that she was symptomatic on the Friday and there was that 4 or 5 day lag?
No, so that's as we always say, the most important thing is that these 3 cases that we're dealing with today and the 2 that we've subsequently approached, they've come forward to get tested. As we've seen in every single outbreak, that's the most important thing that people can do. The timing of that, as we always say, the sooner you come forward, the better it is, because it allows us to get on top of this more quickly. We have a lot of work to do over the coming hours and days to assess with these 3 cases when they came forward, what their exposure sites are, and what their infectious history has been. We'll work through that over the coming hours, and we'll make updates as we need to.
Just on a question not related to this outbreak, but SPC are now mandating vaccines through their entire staff.
Yeah.
Is that a good move, and is there enough supply up in Shepparton to allow staff to be able to do that?
Well, look, as we've said consistently over the last few months, it's always about, vaccine at the moment is all about supply. So as Mukesh has said, there's some fantastic examples where we really started to get good vaccination numbers coming forward, but we still need more vaccine in order to give people access to the supply, the vaccine that they want. It's good to see, I think, generally speaking, organisations, businesses starting to raise the bar on what people expect in terms of vaccination, but we need the supply to come forward to enable that to be delivered.
Just on that SPC.
SPC, yeah.
Just sorry, if you are under 40, you worked at SPC, you're not eligible, and your GP advises against getting a shot, what should those people do?
That'll be a question for SPC.
Just on vaccines, do you think that we'll be in a position with supply and everything else going on for students to be vaccinated at schools by the end of the year?
Yeah, again, look, it's a matter for the Commonwealth programme. I think the indications in the Commonwealth programme are that we see significant increases in vaccine supply from September, October onwards, and look, finally that horizon started to come a little bit into view, which is excellent. We would absolutely hope to be in a position to follow the ATAGI guidelines and to get students vaccinated who are aged over 16. The sooner the supplies are available to do that, the better. Yeah. Yeah.
Are they in a separate household?
Yes.
And they're together in that
Yes, that's right. That's right. So two new cases that we've detected in the last couple of hours, living in the same household, but a different household to the football player. But there is a family relationship there.
Do they work in at-risk industries? Do they work at at-risk industries?
Not to my knowledge at this point.
And the man, you said he worked at Caroline Springs.
Yep.
Do you know where?
No, I don't. Caroline Springs is good enough for me.
And did someone work at a gym against
Not to our knowledge at this point in time. And again, we've now got 5 positive cases in this emerging little area to work through. At this point in time, none of those individuals work in a sensitive setting or in a high risk industry. But of course, we've also got 2,500 primary close contacts associated with the school. There'll be a significant number of household relatives we'll be working with. They'll be in isolation. So this picture will unfold as it always does over the coming hours and days.
How old are those new cases for tomorrow's figures?
I don't have that information in front of me.
Can I just get Mukesh quickly, please? If that's okay. It is just on vaccines. Would you have any qualms about vaccinating a 12-year-old, say, in relation to school vaccination?
We have to follow the guidance of ATAGI. ATAGI is certainly available for 12s and over, and the new suggestion is younger people who are immunocompromised become priority, so that puts a squeeze on the priority vaccines that are available. I think what we're waiting for since the 28th of June is a no-fault compensation scheme, which allows us to then immunise people who are ATAGI otherwise would not recommend to get vaccinated under 60, who can actually very safely get vaccinated under 60 and get on and immunise a whole lot more people.
Do you think that parents will accept vaccinations at school for young students?
Look, I think that just like any other vaccination program, we had this at the very beginning with Gardasil. We had this with the immunised meningitis. So when things are new, people ask questions. They get the right answers when they're given the right information, and most Australians make the right decision based on what's best for their kids.
What's your response to that? Is there still hesitancy?
I actually don't like the word hesitancy. I think people are taking their time to make a decision because the information is so unclear. I think we need to get our core message right, and the core message needs to be you need to get vaccinated because you don't want to die. You don't want the people around you to get sick. We've got 100% of people kept out of hospital, 100% of people getting out of ICU, not getting into ICU, and these are safe vaccines. Unfortunately, everything we do has a risk associated with it. This has been ATAGI giving us guidance around it, but there are ways that we can do to make people safe in that process. So yes, there are many people in the community who are not rushing off to get vaccinated. When they get good information, they make the right decisions based on good information given to them, generally by their GP. And the GPs are core to this, but also they've been made in a difficult position because of lack of supply.
I know we're very early in this outbreak of the Al-Taqwa, but do you think there is practical beneficial to target vaccination in the north and west, given their high-risk areas that have had large outbreaks there?
I just think we need to be ready to go when we get the doses for everybody over 16. Get up and go, no mucking around. So we need to get the systems in place. We need to get the people ready to go. We need the IT ready. We need the booking systems ready. So as soon as the vaccines come, we just go for it.
You've been quite positive about this outbreak compared with last year. A lot of those communities dealt with this last year and they learned from it. But if we are dealing with Delta, it's spreading much more rapidly. We saw in the last outbreak that it spread 4 generations in a week. How much of a challenge is that?
This is a massive challenge, and you're seeing the minister speaking to you, you're seeing Jerome speaking, we've seen Brett speaking. This is so dangerous, so easy to get, that we're being so cautious and shutting a whole school down and their relatives and saying please isolate 14 days. That's not done lightly, but it's done for good reason, with good science, to make sure we don't get into that nose spin and dive with this time. And this year, not like last year, the teams are working together. The department is coming on board. The minister's team's all there. They're working with the community providers and the community, and the councils are part of it. And my council's been excellent at supporting people to get the right support that they need to get what they need done. So even last year, we got to a place where anybody who needed to be isolated didn't have to get worried about being carted away to hospital, to hotel. They could be looked after in their home with the department say so, making sure that they had supply, somebody to walk the dog, cut the grass, get the groceries, and get them their payments from the government that they're entitled to, so they don't go broke sitting at home. They're the simple things. People doing the right thing, and they were getting pilloried by the people around them saying, you got infected. This is an illness. You don't get somebody getting slapped down for getting diabetes. You don't get somebody getting slapped down for getting chicken pox. This is unfortunately a nasty disease. We don't know we've got it. And people are asymptomatic. And, we've seen great people doing great things and getting tested in time.
Has there been a stigma around it that led to a hesitancy to get tested?
Absolutely. This is the problem we saw last year. And it took a lot of effort from our people around to get the right messages to get tested, because it's the right thing to do, then you don't get this thing spreading.
Thanks everyone.